a member of Arabian Society of Histocompatibility and Immunogenomics, which is said ARSI. Dr. Jamil also, he discovered the interleukin 15 rule in the immunopathology of rheumatoid arthritis. He published in Nature Medicine. He also has more than 30 publications in the international journals. Dr. Jamil attended more than 100 conferences. Welcome, Dr. Jamil, to talk of today. And the stage with you now. You can share the slides and you will start.
Thank you so much, Dr. Mohanna. Are you hearing me okay?
Yeah, okay, good.
Okay, thank you so much, Dr. Mohanna Shaybani, for this invitation to participate in your activities. And also thank you for the organizing committee, Dr. Adil Al-Gheethi, Dr. Naif Al-Awais, Dr. Maya, and all the organizing committee in this important activities. I like just to see and to share with you your success in such organizing scientific meeting. My talk just go direct now to the title of my talk is Immunology and Immunodiagnosis of Autoimmune Disorders. Let's just just to give you, this is the only just a brief introducing to our medical center that I'm working with. This is called the King Abdulaziz University Medical Center. We have actually, this is a center, tertiary care in big tertiary care center in Saudi Arabia, consisting of 1,000 bed and huge, a reference center in the western region of Saudi Arabia. And the outline of my talks, actually, it will be just to start briefly about definition and history of immunology, immunology milestone, power elements of the immunology, and then autoimmune definition. And part two, I will just concentrate and discuss about immunodiagnosis of autoimmune disease, method used, and autoimmune profile selection. And I will give you just an important case studies in autoimmune disorders. If we just, this is a basic definition actually about the immune system. Most of you may know this kind of definition, that the immune system is a complex organization, very complex actually organization within the human body that is designed normally to seek and protect and destroy the invaders or the enemies of the human bodies. These enemies could be viruses, could be parasites, could be bacteria, could be fungi, could be pollution, could be toxins. We have millions of enemies around us, okay? Without the immune system, we cannot actually live even for, matter of days. So we have to have, Allah subhanahu wa ta'ala created in our body a very complicated defense system that protects us during health, okay? That is the important mechanism that help us to live in this life, okay? The role of actually immunology in our diagnostic immunology development of healthcare in any nation cannot be fully appreciated without the history and the history of immunology. Just give you brief history. I will not go in details. We don't have time. Just beginning of immunology started in 1798 when the British immune scientists observed and discovered that I cannot see this word because of the pictures here. Can we take this one? Okay. Okay, thank you. Good. That's good. So that he discovered that milkmaids who suffered from cowpox were secure from and immune to the future infection of smallpox. That was actually the first important discovery. That's to know that there is something in our body can, protect us. Then he reported 16 cases of resistance to smallpox, smallpox in farm workers who had recovered from cowpox. Later, then antitoxin, have been discovered in 1990, okay, by Emil Behring and his group, showed that the neutralizing effect of sera from animals infected with diphtheria and tetanus. So, and then continuous of, discoveries regarding the immune system, regarding the immune response, regarding protection, regarding the vaccination, continuous, build up of in this science, okay? But now if we go to immunology during this milestone, in 1798 or 1880, and then, years, we are now in 2020, maybe 2021 now, but the immunology now is not only a matter of a discovery of vaccine or immune response or antibodies. We have now 3 actually branches in immunology. It's called basic immunology branch, and then there is another branch called diagnostic immunology branch, and another branch called clinical immunology. So basic immunology means the physiology of the immune system, describe all receptors, element, tools that the immune system can have to protect and to defend, okay? And the diagnostic immunology means diagnosis, that when you have patients or any disease, the diagnostic branch can help for diagnosis. Clinical immunology means patient management. Today, we will concentrate here about diagnostic immunology, okay? And let's just see, this is the basic elements of the what's called innate immune system. The basic, in our body, basic, defense, the first defense in our body is called the skin, and then the phagocytes, complement, toll-like receptors, saliva, enzymes, normal flora, cilia, NK cells, cytokines, adhesion molecules, and molecular or genetics elements, okay? This is the only brief defense lines in the system called innate immune system or innate immune response, okay? This is actually system is not really specific, but this is, can defend us, but it is in natural, immune response. If we go to another highly specific elements, it's called adaptive immune system. This, can help in so many important, specific or, elements that rely on T lymphocytes, rely on T lymphocyte subset, rely on T lymphocyte receptors, B lymphocyte receptors, dendritic cells, macrophages, cytokines, antibodies, adhesion molecules, and then also genetics. So, we have a complicated, millions of cells, T, B, dendritic cells, macrophages, cytokines, okay? Cytokines is a big network in our body, okay, that, make the signals and the growth of the immune system. We cannot go in details to describe all these functions. This is only a tools for the defense system. So if we just, as you can see in this slide here, this is the immune system. If we have a good immune system, okay, anybody of us, if he has a good immune system, in health, okay, in health, we should not have any disease. If you have a very good immune system, as you can see here, you have so many, cells, you have so many lymphoid organs, you have so many networks in this side. It's called, a specific immune system here. We cannot get any actually disease, okay? Normally we call immunology in health and immunology in disease. Immunology in health, we cannot feel that the immune system, have a huge defense against so many, hundreds of viruses or bacteria, so we don't feed it. We don't feed it. But there is immune system fight without feeding. Okay, if there is a problem with the immune system failure, we normally we have to might get or can get infectious diseases. You can't get or this is you can see it by infectious antibodies, infectious diseases. So many actually, you can call it millions of viruses, bacteria, and then now we have the crisis now in the world called COVID-19. COVID-19 that make actually the world in a disaster. Okay, that's actually important system problem now between the COVID-19 and the consequences of this threat. And if you don't have a failure or immunodeficiency, then some might get something called immune deficiency disorders. Okay, could be primary, could be secondary. This is another problem. If the immune system hyperactive or hypersensitive, some or many patients might come and looking for medication to sort of allergic problems like food allergy, inhalant allergy, drug allergy, and so on. Okay, and if the immune system actually have mutation or genetic mutation or suppression, that is many cancer patients who have cancer. Okay, whatever the type of cancer, but that is due to mutation or suppression of immune system. Okay, if you see a patient with cancer, you look to his immune system that there must be a defect or suppression or mutation in his immune system. Okay, and in immune system also can cause a problem in rejection of organ transplantation, and then you can see many transplantation disorders. The important now talk of the day, if our immune system loss of tolerance to self protein, self antigen, self mechanism, self enzymes, we might, patients might come and requesting for requesting for help to see problems with something called autoimmune reaction or autoimmune disease. Autoimmune means destruction or disorders, means that autoimmune normally, as I mentioned before, the immune system designed to protect and to defense. But if the immune system attacks self protein, self tissue, self organs, will unfortunately go to intensive and extensive self damage, which is called autoimmune damage or autoimmune disorders. This is and we have now, if you go and see the literature review now, you will find more than 500 autoimmune disorders. Okay. But just today, I only just give you a brief about the common disease of this one. Okay. So I will give you just brief here. Give you brief video, animation video, just to give you 5 minutes video about just the immunology of autoimmune disease. But some of you needs have no background about the immune system. You can see now the background of immunology here about it.
Prof. Jamil, the video have voice or no? There is no voice for the video.
Yeah,
no.
Tarek.
We didn't hear anything, Doctor.
Okay, that's the one. ما كانش فيديو، ما في صوت. يقول له في صوت الآن؟
No, Doctor. You can try to make the mic near the computer.
Okay, you can just break as you can. Now you hear me, طيب?
Yeah. For you, okay.
You will see in this video just how the immune system attack the cell tissue and cause autoimmune disease.
Okay.
This is here mentioned that the one of the autoimmune disease called rheumatoid arthritis is cause extensive damage to the joints. And the cause of the autoimmune disease until now, not actually, no, it could be age-related, diet, smoking, genetics, mutation. But this slide just mentioned that the arthritis, autoimmune disease might have, genetic problems, might have, smoking problems, might have psychological problems that initiate autoimmune disease. And the autoimmune disease mentioned here, it could be, before years before that. And this is the antibody produced in the blood that, can help in the diagnosis. You can see the antibody and the antibody develop outside the joints and migrate to the joints. The smoking can, increase the autoimmune problems. This is the how the B cells can produce antibodies. This is only see the role of T cells, macrophages, antibodies, how and they produce and go to damaging the tissue. It's called self antibodies. So the question here, how to prevent this huge, destruction to the joints. Here is the autoimmune response, destroy all the joints in the patients during entering the joints. These cells, as you can see here, when they migrate from the peripheral blood to the tissue, can cause extensive damage in the tissue. Cytokines here play an important, it's called cytokines, as I mentioned before, play an important role in the damage. This is the stage of damaging of and causes swelling, pain, and so many problems in the patient tissue. So here the fibroblasts and produce a lot of enzymes, the proteins, and the cytokines that destroy the whole tissue due to autoimmune reaction and to autoimmune antibodies. This is the osteoclast of the joints, can also cause damage to the and cause cartilage destruction and severe pain in patients. Autoimmune disease can cause not only joints, can cause eyes, heart, skin, lung, gut problems. This is called systemic autoimmune damage. So we can, and help in the diagnosis now, as he mentioned that diagnosis of autoimmune disease can be through the antibodies, through the immune cell. So this is the that was only a mechanism of one disease as autoimmune disease called rheumatoid arthritis, but there are so many. As I mentioned before, this is only example more than 500 autoimmune disease. Could be endocrine, a disor, adult disease, a gammaglobulinemia, alopecia. In every single organs, people might have autoimmune disease. Eyes, heart, gastrointestinal, liver, skin. So autoimmune disease is a huge, becomes a huge problem actually in the world. Okay, so you have so many actually disease around the world now. It depends on from country to country. Autoimmune myocarditis, autoimmune iron disease, autoimmune bronchitis, or autoimmune pancreatitis, autoimmune retinopathy, autoimmune. So this is only examples, from different organs. Okay. We have here problems in Saudi Arabia, celiac disease and systemic lupus erythematosus, called agglutinin, congenital heart block. So we have so many actually, disease in each country. It depends on the distribution from country to country. So patients with autoimmune disorders frequently, how we can know that patients might have autoimmune? Okay. We can know that this patient might have antibodies or cells that cause direct extensive systemic or local damages to the self-human tissue. This we can know when we see patients and wants to get a proper diagnosis. The immune system can tell us, okay, what kind of this disease, what type of disease, what type of antibodies, and how we can screen, how we can confirm, and how we can monitor the patients. The antibodies which produced during the autoimmune reaction is called IgG antibodies. This is just only a structure of IgG. And there's another antibodies called IgM antibodies during an acute inflammatory response. You will see in the patient blood autoantibodies called IgM. And then we can, that was only a basic immune side, And then if we can now go to the immunodiagnosis of autoimmune disease, the diagnosis of autoimmune disease rely on diagnostic immunology branch. Okay, I told you diagnostic immunology means diagnosis. This branch is an important now in medicine, very important branch in medicine that can help early screening, early confirmation, and early monitoring of autoimmune disease. Not only autoimmune disease, the immune system here can, this branch of immunology actually has developed sophisticated advanced immunological methods that utilize the very complex basic immunology tools in the diagnosis, treatment, and prevention of infectious disease and immune-mediated disease, okay? This is the diagnostic immunology. Now you can not only diagnose autoimmune disease, you can make diagnosis for infectious, immunological, allergy, endocrine, cancer, immunodeficiency, transplantation, infertility disorder, dermatology, neurological, and gastrointestinal disorders. This is what we do now in our diagnostic immunology in Saudi Arabia. We have all this kind of facility to diagnose most of these infections. And then we have an important, tools also and sophisticated technology to diagnose autoimmune disorders. This is the diagnostic immunology. That's my experience for the last 30 years, as a consultant diagnostic immunologist. And I've been through this kind of branch. It's important branch in medicine. You can see the immune system everywhere in your body. If there is whatever, infection, cancer, autoimmune, whatever you see, you will see the immune system, okay? And So in our in our diagnostic immunology at Abdulwali University, we are happy. We are, that we have a sophisticated, technology and facilities in the. We are serving more than 300,000 patients per year. We have this unit called Autoimmune Disease Unit. I was lucky to establish and to find this diagnostic immunology. 15 years or 20 years back, I did establish this diagnostic immunology branch with autoimmune disease unit, allergy unit, tumor immunology, infectious immunology, transplantation, immunodeficiency. And we have also diagnostic immunology research unit. We have academic diagnostic immunology curriculum. We are actually responsible for teaching undergraduate and postgraduate medical students in our center. So the immunodiagnosis, what we can see now, we have actually maybe more than 1,000 autoimmune diagnostic antibody testing, okay? But we cannot cover this one. I'm just trying to cover, little just information about that. All this autoimmune antibodies we have. This is only, it's called antinuclear antibodies, antidepressant, antihistone, antiribosomal, anticentromid. So many autoantibodies that can help in diagnosis different diseases in patients, okay? This is all facility. We have it in our diagnostic center. We have, related to kidney, to liver, to heart, to gastrointestinal disorders. We have so many. We have two neurological disorders like vasculitis disorders. We cannot actually, cover all this, but this is only as example about the diagnostic immunology testing. We have, thrombosis problems in patients. We have arthritis. We have thyroiditis. This is only an example of our facility to some of the facilities in autoimmune units that help to early diagnosis and management. Okay, so patients with autoimmune disorders frequently have cytokines also production. Okay, I was lucky actually to find in my first research in Scotland that there is a cytokines problem in patients with autoimmune disease like arthritis. Where I did actually measure the cytokines in my brief first study, and then I discovered that interleukin-15 has a role and published in Nature Medicine in that time with my groups. And then we study here in Saudi Arabia the role of cytokines like interleukin-33 in correlative with the disease activity of bowel disease. So this is an example of that immune system play a role in the autoimmune system. So this is the summary of the first part, that the immune system designed normally to seek and destroy invaders. In case of autoimmune disorders, the immune system destroys self organs. And we go to a case scenario now. Case scenario just to study because of the time now. This is only an if we go to I want just to again the time actually. This is if we go to the case study. This is an autoimmune dangerous and invasive disease called systemic lupus erythematosus. Actually, this and actually a very dangerous disease. There are so many cases in different countries, especially in Africa, in Europe, in the Middle East, in our region here in Saudi Arabia. There are so daily cases coming from different genders, from different countries. In Yemen, unfortunately, there are so many diseases called systemic lupus affecting young ladies, aged from 9 years to 35 years. Okay. Starting with fever, hair loss, skin rash, and then go to the failure of kidneys, failure of sometimes of damage of heart, damage of brain. If you cannot control the immune system, patient might die within a week. So this what we can do in immunology here in diagnostic. If we see these patients, okay, we can go for screening for antinuclear antibodies, screening for. It's called screening. We confirm by something called antidepressant DNA antibodies. We go for other confirmation called anti-Smith antibodies. And then we see if there is a thrombosis in patient might comes, we see anti-cardioid antibodies. If there is a kidney problems, we go for complement C3 and C4. So in immunology now, we can see and analyze how the SLE or systemic lupus autoimmune, what can have of the damage consequences in patients. So we can early measuring antibodies to know if this patient go for kidney, can patient go for thrombosis, for DPT, for kidney failure, for neurological problems. We can know during measuring of antibodies. So if you have this facility, actually, you can make early diagnosis for SLE. So SLE, becomes a big problem if you don't have early diagnosis. Okay. Early diagnosis means more than 90% prognosis. If the patients came late, unfortunately, some patients, they came late to our center, end stage, renal damage, renal failure, heart problems, and then they die in the ICU. Okay, if you cannot pick this up patient earlier, they and can handle the immune system, patient will die, unfortunately. So this is a case here, patient with active SLE. We just in immunology we see the ANA, antiparasite DNA, all these markers here confirm that this patient has active disease. Okay, and then from this data we can actually monitor, confirm, and follow up patient medications. From this data, we can know how we can manage the patients earlier and give the patient the proper dose and proper medications. This is another disease called, actually, here you see different, has ANA only and has only a marker called anti-SCCL70. This is called, scleroderma patient. So this is different from SLE. Scleroderma also, this is a skin problems, cause death sometimes in some patients if you don't treat early. This is another disease which ANA and another marker called anti-GO1 strong positive in the patients called polymyositis dermatomyositis. Okay, affect muscles in the patients. We can easily make the diagnosis in diagnostic immunology and confirm. And this is another disease also. It's called mixed connective tissue disease. This is mixed, the patient have different damage, different inflammation, different, problems in his joint problems, but we cannot see, is it SLE, is it arthritis, is it scleroderma? It's called mixed connective tissue disease. If we go to arthritis patients, some patients come to our hospitals handcuffed, as you can see here, deformity of the bone, and some of them, you see them handcuffed. They cannot even move due to late diagnosis. What we do in immunology here, we go for rheumatoid factor, anti-nuclear antibodies, complement, selective protein, and something called anti-CCB, anti-citrullinate cyclic peptide antibodies. This is the markers for diagnosis of patient arthritis. How many minutes you still have, Dr. Muhanna?
Still, Doctor, 15 minutes.
طيب شكرا. طيب في الrheumatoid arthritis, if you have patients coming with early arthritis, we can easily know from the screening of patient, do this patient have inflammatory factors like selective protein or anti-CCB. Then we can see from the clinical symptoms of the patients, then we can confirm it by diagnostic immunology testing. Like here, we go for the most important is anti-CCB, confirmatory testing for arthritis. And selective proteins actually help us in the monitoring of patients. Rheumatoid factor might help, anti-nuclear antibodies just to rule out. But the important markers here is the selective protein and anti-CCB actually, okay? So we can, in immunology, actually, when we make the diagnosis early, the patient will not, go to the, actually, to this kind of, this is actually, unfortunately, this late diagnosis of rheumatoid arthritis. It is difficult as a medical consultant or, immunologist to see patients come to the clinic with the deformity. So this is a case study of arthritis patient. This is before medication. The anti-ANAC 160, anti-CCB was high. Anti-MCV also another, antibodies was high, and CRP was high. After medication of, after 3 months of medication, you will see the difference now. The anti-CCB, still the CRP here, it was, you will see the difference here, okay? This is for those who are working in the field of immunology now. Everywhere that, I mean, in these countries that, see my lecture now, okay? The anti-CCB is a confirmatory testing for rheumatoid arthritis, but is not a monitoring testing. Unfortunately, in different countries, they are using anti-CCB for monitoring, okay? They said, okay, this is a confirmatory testing. When they start medication, consultants usually keep asking for requesting anti-CCB. From our experience now, anti-CCB is not a monitoring, although it is a confirmatory, but is not monitoring for medication. The most important tools for monitoring is C-reactive proteins. Although CRP is not a specific marker for arthritis, but is important marker for CRP. So those who are practicing medical side and monitoring patients or taking care of patients with arthritis, they should look to our experience here. CCB as not, or MTNCV is not an important marker for monitoring, important marker for confirmation, but for monitoring, you can only use C-reactive proteins. So we have studied this one, in our, I have published this one in the immunology journals experience that the CRP and CCB actually is not important for monitoring, but important for confirmation. It has been published. If you go to another dangerous disease called autoimmune hepatitis, patients come to you, to the clinic, to the hospital, to the ICU, to the emergency, having liver problems. Liver problems, okay? Liver failure. And you might see the patient early, but if you see the patient late, that's dangerous. Okay, you cannot do anything. But if you see the patient early with autoimmune hepatitis, you can go to the Diagnostic Immunology site, screen the patient, confirm the diagnosis, and then you can start medication, and then the patient, inshallah, keep well. But and the immunology here, there is in autoimmune hepatitis, we classify them to type 1, common form in North America, and there is another form called type 2 autoimmune hepatitis, typically affecting girls age 20 years. And this is actually patient come with fatigue, with hepatitis, with jaundice, with skin itching, joint pain, abdominal discomfort, many clinical pictures. If you see these pictures with the patients, you will might think that this patient might have autoimmune, but autoimmune, you have to go and take the blood of the patients and then do the antibody screening for, this is the, we do here the screening for the patient. We see the antibodies here, it's called either call it anti-smooth muscle antibodies or LKM antibodies. These antibodies confirm the diagnosis either type 1 or type 2. You can easily make the diagnosis, see the diagnosis, confirm it, report it to the medical consultant, and you can start medication early. Otherwise, the patient might die. Okay, this is a case of 27 years old. Saudi woman with actually with comes with hepatitis. She was having abnormal LFT, and the antinuclear antibody was high. Anti-Palestine DNA was normal. Anti-smooth muscle antibodies was high. Anti-actin antibodies was high. IgG antibodies high. LKM normal. That is indicated type 1. Anti-AMA normal, and hepatitis markers were negative. So if you see patient like this, abnormal LFT, high ANA, high smooth muscle antibody, anti-actin antibody, for sure this is autoimmune hepatitis. You don't need to wait. Go and do the medication. As you can see, this is the hepatitis markers negative. So autoimmune hepatitis, you don't need to wait for the. You have to go for medication, just to avoid patient liver failure. Vasculitis. Patient might come to you with vasculitis. You might some of medical doctors in the field might, make the wrong diagnosis. They might see this could be allergy. Okay, this is not allergy actually. When you see the patient like this, from the history, you will see vasculitis. Vasculitis, it is autoimmune disease. Okay, due to that, the antibodies damage the vascular blood vessels. We can make the diagnosis by antibodies called ANCA, anti-neutrophil antibodies. There are two types of ANCA, B ANCA, C ANCA, that can help in the diagnosis of vasculitis, okay? And the ANCA, discovery was actually, in 80s, and then ANCA now help in the diagnosis of many patients with vasculitis. We have reported in our research here in Saudi Arabia, a role of ANCA in pediatric inflammatory bowel disease, in international journals, and we reported different, and in the, different case scenario of patients. So in summary, actually, I cannot go to the summary in scientific, scientific points, but we must actually, if we see daily the autoimmune disease in different patients, neurological, liver problems, heart problems, ophthalmology problems. So you will see that we can say, actually, we must continuously pray Allah subhanahu wa ta'ala to have in our bodies protective, not destructive self-immune system. Thank you so much. I'll stop here, Dr. Muhanna. The subject is huge, but I was trying just to make a proper, a summary for visitors.
Thank you, Prof. Jamil. Thank you so much for a very nice presentation and very clear presentation, actually. I know immunology is so huge, so it takes more than that time to explain. Now we will open the question and answer, inshallah. Anyone wants to ask, please raise your hand. We will open the mic for you. The first is Dr. Abdullah Al-Mahdi. He wants to ask. Please, doctor, open your mic. Dr. Abdullah.
Okay, assalamu alaikum, and thank you very much, Prof. Jamil Al-Mughales, and also the organizer. Thank you for this clear, information about the autoimmune disease. As we know, we have two types of autoimmune disease and also immune disorder. The first question, how we can differentiate between autoimmune disease and also immune disorder. This one. Second, we have two types of autoimmune disease, the genetics and non-genetics. For example, like in genetics, we have ABEX, ALBAS, and different, also which X-linked with affected. And for non-genetics, we have infection with another, for example, microbes, which also causes this non-genetic autoimmune disease. How we can differentiate in the diagnosis test between this genetics and non-genetics? Thank you very much, Prof.
Thank you, Dr. Abdullah. This is a good question. In answer to the first question, the difference between the two types of autoimmune disease. Actually, autoimmune disease is not only two types. We have we have a type called autoimmune reaction, and then you can see autoimmune disease. Okay, autoimmune reaction. Most of us we might have little autoimmune reaction, but not autoimmune disease. Okay. You have in your body, if you get infections to any viruses or to any bacteria, you might have sort of autoimmune reaction, but not autoimmune disease, okay? Autoimmune disease means you see the pathological damage in the patients, okay? Whatever the autoimmune, you have so huge number, as I said, more than 500 autoimmune, disorders. When you see the patient's, damage, extensive, and clinical picture, then you can see patient has autoimmune disease now, not autoimmune reaction. Some of patients starting with autoimmune reaction, and you see the result of antibodies highly strong, and they don't have clinical problems. You need carefully to follow up them, okay, to follow up. After 1 month, 2 months, 3 months, 1 year, it depends. If the patient has autoimmune reaction, tell him oh, patient, you have only now antibodies, but you don't have disease. Please, when you feel that you have any clinical pictures, contact us and come to us to the hospital to go and start monitoring and give you the proper medication. Some, unfortunately, they said to the patient, oh, don't worry, you have only antibodies. Go, don't worry, don't have anything. And they don't follow up the patients. If the patient has high antibodies, okay, and has no clinical pictures, tell the patient to, see his, body and his any clinical picture changes. If he has some, like for example, arthritis or SLE antibodies, if the patient feels that he has a joint problems or skin rash or hair loss or any kidney problems, they should go back to the medical consultant to see that my autoimmune reaction now, unfortunately, goes to autoimmune disease. So you can catch the patient early, and you can give him the proper medication. That is the answer to the first questions, okay? Regarding the second one, for sure, that there is a genetic mutation due to drugs, due to virus, due to bacteria, due to so many environmental factors, unfortunately, might cause autoimmune problems, okay? How we can make the diagnosis? We can go to diagnosis through either through the autoantibodies. If it is, we call it local damage to the tissue. We call this is a pathological antibodies or something called systemic autoimmune disease. It depends on the clinical picture of patients. And you can know, is it actually due to genetic mutation that sometimes genetics might produce or create self-proteins that mimic, cause the immune system to recognize this as, self as non-self as self, and starting to cause autoimmune damage in human body. So this needs actually careful technology to see what kind of gene, what kind of antibodies, and what kind of disease to make the proper differentiation and diagnosis.
Thank you, Prof. Now, Al-Qasim Ibrahim. Al-Qasim Ibrahim, open the mic. Where is he? He just raise his hand. Abdul Mannan, open your mic. Dr. Abdul Mannan. Open the mic, Abdul Mannan.
Are you hearing me? Okay. Yeah. Thank you very much for Prof. Dr. Jamil. My question, as we know, that one of the causes of autoimmune disease is associated with the infection with the virus, or sometimes taking of the vaccine. Do you expect the infection with COVID-19 will increase autoimmune disease, or also if you are taking the vaccine of COVID now as new vaccine is associated also with increase autoimmune in the patient who's receiving of this new vaccine? I suggest also to be one study for who's received this vaccine as new vaccine was associated with autoimmune or disease.
Okay, this is a good question, Abdul Mannan. Actually, COVID-19 vaccine is still a new vaccine, okay? You are right that the viral, as I mentioned before, virus can cause autoimmune problems. يعني الفيروس لما يدخل الجسم احيانا يسوي فتنه احيانا في الجسم حرب اهليه اوكي يعني autoimmune لكن COVID-19 الان still until now there is no unfortunately studies on the vaccine. The vaccine is still new. We are actually looking now for those getting the vaccine to monitor them during inshallah during the next month or 1 year to see the vaccine side effect can cause autoimmune. Until now we don't know. Unfortunately, the vaccine, the COVID-19, we don't know the duration of immunity until now. Is it 3 months, 6 months, 1 year? We don't know, okay? Is it kind of cause autoimmune disease? We don't know, okay? We don't know. So we have to see We have one project now monitoring the immune response from the vaccinated people. We are monitoring, inshallah, for the next 6 months, and we'll see the vaccination response. Then we can see even the side effect, autoimmune disease, or another, complications. Could be another things. We don't know yet. We have to wait. We have to wait, Dr. Manu.
Yeah, you have to wait.
Thank you, Dr. Khairullah Al-Ghazali.
Assalamu alaikum. Yes, thanks so much for a wonderful talk and comprehensive talk. And I have question, sorry, Prof. Jamil, is technical question. You mentioned a lot of immunological tests. We run this, we have choice to run this test, like we can do by chemistry or like by ELISA or by immunofluorescent or so on. So what's the best from your experience in your center? What's the best method or more accurate and can run like quantitative, semi-quantitative or qualitative? And what's the best method?
Dr. Khairullah, shukran jazeelan. So this is a good question, regarding the method for autoimmune diagnosis. Actually, in immunology or in diagnostic immunology, I mentioned before, we have methods for screening, we have methods for confirmation, and we have methods for monitoring, okay? If you go for screening, it depends on the disease itself, okay? If you go to SLE, systemic lupus, you have to screen for ANA, not qualitative. You have to screen by immunofluorescent, see the antibody titer, okay? And then you confirm by ELISA. And then you can even do some of patients, you can do plotting assays, okay? It depends on patient. If you go to arthritis patient, you cannot use immunofluorescent. You can go for ELISA. You can go for plotting. If you go for multiple sclerosis, you cannot go for immunofluorescent. You go for something called monoclonal antibodies, or sorry, it's called polyclonal, or it's called another antibody is called oligoclonal antibodies. Okay, so this is different from patient to patient. You can use immunohistochemistry. It depends on the. If you go for autoimmune hepatitis, you can go for immunoglobulins by called immunoturbidometry method. You can go for ELISA method. You can go for immunofluorescent. So it depends from disease to disease, what kind of selecting tests you can start with. Regarding qualitative, I don't like to use qualitative in autoimmune. You have to go for either semi-quantitative or quantitative just to get the prober to see the highest concentration of antibodies in the patients. Then you can monitor after medication. If you see ANA positive, for example, positive means nothing. If you see reactive protein positive, CRB positive means nothing. You have to go for concentration. You have to go for numbers to help the consultant or the patient for monitoring the medication and the prognosis.
Thank you.
Thank you, Prof. Now, Awal Ibrahim from Nigeria.
Assalamu alaikum.
Assalam.
Alaikum assalam.
Thank you, Prof, for these wonderful presentations. My question is, can child have this autoimmune disease, and how are we going to observe?
Okay, it depends on the age of a child. If you go, for example, if the patient, for example, like SLE, if the SLE patient has a baby, infant, sometimes you might be careful, like SLE patient. You might expect the patient has, autoimmune problems that cause cardiac problems. You go after delivery within 72 hours. You have to if the patient is SLE, if the mother is SLE, unfortunately, and the baby, you have to screen the baby for autoimmune antibodies. It's called, for example, anti-RO or anti-SSA. Okay, you can see if after 72 hours, screen the patients. If there is any antibodies, can cause the damage, you can early screen, or you can even monitor after 3 months or 6 months. Okay, this is for an infant. If you go for the children, many patients have juvenile rheumatoid arthritis. You have a patient called neonatal SLE. You have patient, starting in children from, some of them they have starting from 9 years and and up until 14, 15, 16 years. It depends on the clinical picture of patients. If you see patient have joint problems, you can look to the juvenile arthritis. If the patient have SLE, you can see the SLE patient. If patient have cardiac problems, you can see is that autoimmune or something else. It's easy to make the diagnosis from the clinical pictures and from the screening of antibody response in patients.
Okay. Thank you, Prof. Thank you for the answer.
Prof. Yusuf, open your mic. Yusuf. Yes.
Alaikum salam.
Brother Yusuf.
Assalamu alaikum.
Okay, Maimuna, open your mic.
Yeah, assalamu alaikum. Yeah, I'm Maimuna, PhD student from UKM. Thanks a lot for the very informative session. So I would like to ask about the course of treatment, if you can give us an overview on the treatments available. So because what I'm aware of is for autoimmune disease, there is no cure. They only use anti-inflammatory and immunosuppressants like cortisone, corticosteroids, and so on. So is there any advancement in the treatment of autoimmune disease recently?
Yeah, Dr. Amina, shukran. This is good, very good question. Yes, of course, there are now so many advanced medication now in the field. Although this medication will not to stop the 100% the autoimmune process, but there is, there are a good medication now. It's called biological therapy. Okay, if the patients might have like active rheumatoid arthritis, now they can go for see the problems. Is it cytokine problem? Then they have to select anti-cytokine like anti-TNF or anti-IL-17 or anti-6 or anti-interleukin 1. This is more advanced medication. It is costing, but is good, medication now. You can give the patient this kind of medication, and it, you will get a very good prognosis of the disease. You can go now, as in some patient like SLE, you can go and block the B cells. You give the patient rituximab and block the B cells, but you have to be careful that the patient might go, to infectious problems. You have to make like monitoring the immune system, right? But you have, it depends on patient's clinical pictures. You can start either by either patient go to the biological therapy or monoclonal antibodies. This is advanced medication. Or you can start in some patient with it's called the first line, drugs, anti-inflammatory drugs, and you can in some patients you might have, prednisolone. It depends on the activity of the disease. But advanced medication, there is advanced medication, but still now it is costing. It is costing a lot of money.
Thank you, Doctor. Thank you, Maimuna. Last one, Idris. Idris, open your mic.
Assalamu alaikum warahmatullah. Can you hear me, sir? Assalamu alaikum.
Salam.
Sir, thank you for this wonderful presentation. My question is, as it has been shown on the video that has been streamed, that some things usually are held in the autoimmune occurrence. So on the food, what type of food causes or that can bring about these autoimmune diseases? Thank you, sir.
Okay, thank you, Idris. If you go to the causes of autoimmune disease, let me to tell you just from my experience during the last 30 years in immunology. The first cause of autoimmune disease actually is psychological problems, okay? People used to have, so many, stress, emotional problems, negative, problems, and this is causing stress, psychological problems, actually make the immune system mutated sometimes and cause the problems. Smoking actually, have problems. Radiation make problems. Utilization of overdoses of medication. For any reason, antibiotic. For any fever, antibiotics, and so on. So regarding the food, I don't think so. Food is a big issue now for autoimmune disease. The problem with autoimmune disease is environmental problems rather than, you can't go for the food. Food, it might be there are food, but I cannot give you information now to blame meat or a chicken but some people, okay, they have a dangerous food. It depends on the immune system. They call it actually allergy problems or hyperactivity problems. Some of them consider it autoimmune, like celiac disease. Celiac disease is one of the autoimmune. This is the gluten. Gluten is in the wheat can cause the autoimmune problems. So if anybody has celiac, you can stop the gluten. Okay. Some people might have another food problems like cause autoimmune, a sort of allergy. It depends on the immune system. People might have allergy from fish. People might have problem from from cheese, from egg, from something else. This is might cause allergy, but it is in a way it is autoimmune. It causes a damage to the human tissue. So it depends from patient to patient. I cannot tell you what kind of food. This is you can ask the patients what is his enemy. When he eats something and start have clinical problems, he can give you the clue what kind of food. But you cannot give to make a diagnosis. Patient can help you to make the diagnosis for what kind of food he is taking.
Thank you, Prof. Thank you so much.
Thank you, Prof. Dr. Talal, Prof. Talal Salam.
Thank you very much, Dr. Jamil. As usual, I enjoyed your talk. One of the favorites to me is immunology, and it's very related to my specialty. I just have some comments on the question that have been already asked with the autoimmune diseases as a result of infections, and whether autoimmune diseases can arise as a result of COVID-19. We have so many examples of autoimmune diseases triggered by infectious agents. We have already the post-streptococcal infections, the post-streptococcal complications, which arise as a result of infection with Streptococcus group A Streptococcus. This type of infection is a throat infection, but the outcome of that later on is a complication that appear in a form of rheumatic heart disease and glomerulonephritis. These are basically autoimmune diseases, but they are actually triggered by an infectious agent. The rule of infectious agent is probably the similarity between the epitopes of the components of the bacteria with the epitopes of the heart valves in the case of rheumatic heart disease, and the epitopes of the glomeruli in the kidneys in the case of glomerulonephritis. We have also another example, which is type 1 diabetes, which is actually triggered by Coxsackie virus B. These are all examples of autoimmune diseases that result from infection. As Dr. Jamil said, the autoimmune disease can be triggered by any cause. It could be an environmental, it could be medication, it could be also an infection. Already COVID-19 has proved that it to some extent is an autoimmune pathology. It has an autoimmune pathology, and most of the people who die because of the autoimmune pathology that result from that is actually induced by the virus in some individuals. The so-called cytokine storm. The cytokine storm causes the respiratory distress that arise as a result of infection as a result of COVID-19. And the outcome of this is severe respiratory distress that might cause the death of patient. So always we in the microbiology side, we think that the outcome of infection in many cases are autoimmune or pathological or immunopathological outcomes. We consider this to some extent as autoimmune outcomes of the infection that are triggered, probably in a specific term. The immunologists like Dr. Jamil may not completely agree, but we call these immunopathological consequences of infections as autoimmune. And the treatment is basically based on treating these consequences, blocking these consequences, trying to decrease the impact of these these pathological immunopathological consequences, so that the patient can survive. And the question of treatment, I'm not in a position to talk about treatment, but I could say that the treatment at the moment is based on the switching of probably the immune system as a whole by immunosuppressant. But I think Dr. Jamil has already shown or hinted that there might be some autoimmune diseases that are specifically directed to the specific mechanism that cause the disorder itself. So the more we do research, the more we find out on each specific autoimmune disease, how this autoimmune disease is triggered, and which part of the immune system has been induced to cause this disease, and then we target specifically the treatment to that particular mechanism rather than suppressing the whole immune system. Thank you very much.
Thank you, Dr. Talal. Thank you so much for your comment. Yes, you are right here. Regarding the COVID-19, those who died from from COVID-19 is not due to virus. It's not due to COVID-19 virus. It's due to immune system migration from the peripheral circulation to the lung, tissue, and cause extensive damage to the lung tissue due to, as you said, the cytokine storming or cytokine production that really increased the inflammation, the damage, and cause the lung damage, and the patient unfortunately died due to not virus. Some people, they think that the killing of the virus that killed the patient. No, the virus only induced migration of the immune system to kill the viral infected cells. Okay, and cause unfortunately damage, and then the patient cannot create and healing new cells for respiratory problem, for respiratory functions. That is the problem. Damage without healing cause death of the patients.
Thank you, Prof. Thank you. Actually, I have last question, Doctor. The role of B53, protein 53 autoantibodies to detect early detection of cancer. Can we use autoantibodies from B53 to diagnose early cancer diagnosis?
Yes, this is a nice research you have done, Dr. Muhanna. I think you can, from even one single protein, you can diagnose if there is any sort of autoimmune related with cancer. You cannot say this is B53 cancer. You have to see what kind of cancer, but it is really antibody cause pathology and cause goes proliferation to cells that produce cancers. This is I think you have the details of this one. Pathology, autoimmune pathology is different from cancer cells production, okay? So if there is cancer, you will ask cancer due to what? Due to mutation of cells or due to autoimmune initiation, okay? You have to see this question. Is that the B53? Immune system produces antibodies to B53. This is true, but antibody against B53 initiate autoimmune damage or initiate cancer cell production. Okay.
Yes.
This is actually, Dr. Muhanna, I think you should know this. You should, study this, Is it the anti-p53 initiate autoimmune damage or initiate cancer cell proliferation?
Okay, thank you, Prof. Dr. Adil? Dr. Adil Gheethi?
Yes, yes.
Yes,
Okay.
we already in the final. Just you close.
Okay, thank you so much for Prof. Jamil, and really very interesting topic today is related to our health, and we are very happy because today we are going to close this event that we have started by last November, and up to now 2 months. And we are very lucky because so many of the respected speakers from different countries, they agree to join us. And for all of our audience, there are more than 3,000 audience there for 2 months. We are going to continue, but yes, we have to take a rest for 2 months because we are in the end of the semester. And we are going to start, inshallah, by March. We are going to do more and more activity and more, inshallah, training. By next activities for us will be including some of the training for the research. We will be happy also to have such speakers like what we got before. Thank you so much for all audience, and the certificate for this activity, we are going to share with you the link in the WhatsApp, and you can find all the certificates, and we already share with all the audience the certificates link, so you can download your certificates from November up to now. Thank you so much, Prof. Jamil. Thank you so much for our organizer, Dr. Muhanna, Dr. Naif, and Muhammad Sahari. Where is Muhammad? Okay, thank you so much for all. And inshallah, see you on March. We will keep in touch by our WhatsApp group for any update. Yes.
Okay.
And you want to add anything? Dr. Naif?
Okay, thank you for all. Yeah, we can close the session. I think we can close the session.
Okay, thank you so much. Thank you so much.